Well, mommy brain is what a lot of people refer to as the brain fog that comes with pregnancy, especially the later stages, as well as a few months after giving birth. And it's been misconstrued as brain fog. What it really is certain skills that weren't that important before, like differentiating between different cries, reading looks on somebody's face, like a baby when they can't talk to you. Those skills have begun to take over the real estate in the brain. You haven't lost skills, it's just they've been screened out temporarily by the more important skills.
Right. And now, how long would this last, the change in the brain?
Well, that kind of change in the brain could last for, say, 2 to 4 months until after you've gotten used to the baby, and then the other skills start coming back. You know, any new skill takes all your attention, and it takes attention away from others.
But it can be worrying if you feel like you're not on top of your game when you try and go back to work. Now, what can help with that? Do you have any tips for that?
Well, what helps is a lot of times to realize you're not the only one, to join a group of new mothers, to read up on what's likely to happen, and to find a therapist who's sympathetic to postpartum symptoms, postpartum lag, the brain fog. You know, a woman described it when she went into a doctor and it was a day late, and the receptionist said, "That's okay, I know you're pregnant." And people take that as a negative, but it does happen. You put aside certain things like adult appointments for raising the baby.
Now, one last thing before we go, is there anything moms can do to maybe get over the mommy brain faster? Is this even something they should want or do, because it obviously has a biological purpose?
Well, yeah, exactly. What they have to do is first accept it and then realize how they can structure their time differently. You know, they used to say, when you're at work, forget that you're a mother. When you're at home, forget that you work. So what they can do is learn to compartmentalize a little bit better. And that happens naturally as you know the child's needs. It becomes second nature, and then you're able to focus on other things. So you really can't push it. But, you know, you can read to the child. You don't have to give up all your skills. You don't have to talk baby talk. The baby likes to hear you talk mommy talk and adult talk also. That's how they learn to speak.
Thank you so much for those tips, Dr. Jean Cirilla. I really appreciate it.